Okay, so welcome everybody to today's special content call with the 21-Day New You program. We've got Whitney Madden back with us again for her what's now her fourth presentation on brain health, since she did kind of an opening presentation before we officially launched the program. Today's going to be all about digestion, and the official name is how to promote a healthier digestive system for better immunity and brain health. Whitney and I talked about an hour or so ago. She was wanting to know if I wanted to advise her to rein it in on the content a bit, because she's got a lot that she's excited to share. And I said, you know what, because this is going to be recorded, if people have to leave early or just get a little bit overwhelmed with the amount of content, feel like they can't take it in anymore, the recording is going to be available to you. So I said, let's not shave anything off content, since you guys will have access to it later on. So she's got to just buckle your seatbelts, strap yourself in for what should be a very informative and hope probably inspiring presentation by Whitney. And I'm going to have to sign off myself about 5 o'clock. I obviously won't end the call if it goes past 5, but I'm going to let Whitney be the official one, the one to officially close today's call with you guys if it goes past 5 o'clock. So with that, Whitney, welcome back, and the show's all yours.
All right. Thank you. Thank you for having me. And hello to everybody. Hope you're having a good Wednesday so far. Today I am going to be sharing about, I'm going to give you a little bit of background of what Western medicine has found about the digestive system, which I think has certainly elevated our knowledge in the past 5 to 7 years of brain health, which also affects immunity. And also, of course, affects mood. So I wanted to give a little bit of background on Western medicine's perspective about gut health, and then go into the Chinese medical perspective of digestion, and give another perspective so that you have a little bit more holistic understanding of how gut health works in your system, what it affects, and then what to do, how you can best support it. So that's what we're going to do today. So the first thing we're going to talk about is, from a Western medical perspective, is that Western medicine has said that the gut is the second brain, and some scientists would argue that the gut is the first brain and our head brain is the second brain. I'm not sure I've come to land on either one. I think they are both equally important. And they certainly affect each other in their functioning. So, the gut, the intestines, the stomach, the spleen, the gallbladder, all of those parts of when I say gut, that means all of that: the small intestine, large intestine, stomach, spleen, gallbladder, liver, all of your central organs is part of the gut. And they are loaded with nervous tissue. And they are in direct communication with what's called the vagus nerve, which is the longest nerve in the body. And the reason that we get butterflies when we're excited, or sometimes may have even loose bowels when we're upset, is because of the direct connection, because of that vagus nerve, and because of that direct connection between the head brain and the gut brain. So anxiety, depression, stress, and grief all express themselves with emotional pain in the brain. That's how we experience it, right? Is we have an emotion that then gets stuck. And as well, it can affect our digestive system. So an 80 to 90% of our neurotransmitters, which is what makes our head brain work really well, 80 to 90% of those are created in the gut. So it is super, super critical that our gut is healthy and strong for our brain to be healthy and strong, and for our emotional well-being to be balanced, and so that we can feel joy and happiness and all of the good emotions. So the gut is really, really important. So in the gut, they are finding millions, trillions type of bacteria. And what they have found is that when the good bacteria are decreased, that the bad bacteria take over. And so medications like antibiotics that wipe out the good bacteria, the good flora in our gut, oral contraceptives, proton pump inhibitors, steroids, NSAIDs, like all of those medications will actually decrease our gut bacteria. So if you are on any of those, do not panic. There is something that you can do about it, and we will talk about that as we go. But first, right now, we're going to talk about why the gut bacteria is so important. Stress will absolutely decrease the gut bacteria. Anytime that we take in sugar, that is going to decrease the gut bacteria, especially artificial sweeteners. We talked about that last time. If we have allergies of any kind, and that includes environmental allergies or food allergies, allergies to perfumes, to smells, to scents, anything like that, that is a sign that the gut bacteria, the bad bacteria are in charge, and they're taking over instead of the good bacteria keeping things in balance. Other things that affect the gut bacteria are toxins, pesticides, heavy metals, alcohol, some bacterial chemicals in water. If you don't have clean water, will actually increase the bad bacteria in your gut. Infections, things like H. pylori or parasites will actually increase the bad bacteria. Radiation and chemo will absolutely affect the gut bacteria. I find when I work with clients who have had any type of cancer treatment, and some people it doesn't affect, but some people who have brain fog or memory issues after they have chemo and radiation is because their gut bacteria has been severely challenged. And so there's things that we can do for that. And on the other end of the spectrum, for those who have really high intensity exercise, so I'm talking like, marathon runners or, triathletes and things like that, who are really working their body really, really hard, like kind of overworking their body, that will actually decrease the good bacteria in the body as well. Because again, the body's going to resource. So it's like, well, hey, if you're pushing me to physically work so incredibly hard, like not a normal human level of exercise, then something's got to give. And so it's going to take energy from the gut, and that's the only place to get it from. So it's going to take it from there. It's going to take resources. It's going to take the good bacteria out to be able to then help that extreme athlete work well. And so in doing so, it throws off their good bacteria. So there's a couple really interesting studies that I think is really fascinating and helpful for people to understand about gut bacteria. So in 2012, there was a study where the preschoolers and the kindergartners, they took probiotics, which is a probiotic is putting in the good bacteria. So it's typically through a capsule. We'll talk about dosages and all that kind of stuff a little bit later, but so they were taking the good bacteria in probiotic pill form 1 month before school started. So for 4 weeks, preschoolers and kindergartners took probiotics. added good bacteria into their system. And what they found was they had a significantly less rate of being ill in the fall and the winter. So it lasted, that 1 month lasted 4 months of fall and winter, and actually increased their immune system. So they were not getting sick nearly as much. And I think testing the preschoolers and kindergartners is a pretty good group of people to test for, because that's when their immune system is building and they're touching and putting everything into their mouth. And so if you can build their immune system just after 1 month that will last 4 months, you can imagine what it can do for adults. So good bacteria is super important for the immune system. So good probiotics, and I promise we'll get there. I know you have specific questions about that. And another study that was done was they showed that 70% of all patients who were treated for chronic gut disorders, for chronic gut issues, experienced either an early childhood trauma, like a parent's divorce, chronic illnesses, or parent death. And so what they found was, if we as a child, while our gut bacteria is in process of getting balanced and strengthened, if we've had a trauma of some sort in our childhood, that we've actually started out with less good bacteria in our systems. And so that means that could come out as learning disabilities, that could come out as mood disorders. And mood disorders, I mean anxiety, depression, bipolar, anything along that spectrum. So what they found was that early in life, along with an individual's genetic background, it actually programs how the person will respond to stress for the rest of their life. So just want you to take that in. That is amazing research that they have done, that in the holistic and the integrative care community, we know about that. We know that traumas affect the person's psyche for the rest of their lives. But to see it from this Western perspective, I think was a really profound study that they did. And it was 70% of the people who had chronic gut disorders. So that could be IBS, Crohn's, chronic diarrhea, chronic constipation, anything in that realm. Those people, 70% of them had personal childhood traumas. So there's things that we can do for that. But what I want people to know is that the root of it is in the childhood. And so we can't do anything about the childhood, but what we can do is help to build it now. So to me, it's really important from a Chinese medicine standpoint. I'm always looking for the root of the issue. Like, what is if somebody comes to me and is like, I have bad bacteria and I have bad digestion, I want to know why, because I want to be able to treat it holistically from all perspectives. So another study that they did in 2009 was actually with people who had been diagnosed with chronic fatigue syndrome. And I say that in quotes because chronic fatigue is a catch-all that people got put into that category, where they had, difficulty getting up from bed. They had very low energy, low motivation. Their brain health was not very good. They had difficulty thinking. They were depressed. There was anxiety. So there's all those factors going on with these people. And what they did was, the study was that they got 3 probiotic doses per day. And they did this for 2 months. And the probiotics, again, are adding good, healthy bacteria into the gut. And then the placebo people, there was a placebo group as well. They didn't receive anything. And so they did this for 2 months, and 73% of the probiotic group had increased good gut bacteria, and they had a significant decrease in anxiety. They felt less anxious, calmer, better able to cope with stress. They slept better, and they had fewer heart palpitations. So 73% of the group who took the probiotics, that's in a Western medicine study, they're always looking for like 30 to 40%, like if there, or even a 25% change. To have that big of a change speaks volumes. So one of the things that we want to look at is we want to look at things that we can control, right? So food is one of our greatest benefactors and greatest dangers. So we want to take a look at our quality of food. 70% of the total antibiotic use in the United States is for livestock. And so it is really, really imperative that we are not taking antibiotics when we are not needing them for our system. So it's critical to focus on eating antibiotic-free, hormone-free, grass-fed, free-range meats. If you're going to eat meats, that is really, really important. It's got to be clean. And fortunately, here in Asheville, we have a plethora of resources. And I know there's this meat national shortage going on, but we can still get good meat. And if you're going to eat meat, you want it to be high quality and without the antibiotics. Because if you take in the antibiotics, your immune system's going to go down, your brain's not going to work as well, and you're going to cause yourself digestive issues and brain issues and immune system issues. So really, really important. So I want to move into how Chinese medicine is described, or how Chinese medicine describes digestion. And digestion, Chinese medicine is based on thousands of years of human evolution. It's based on observation. It's based on half the world's population being observed over thousands of years. And, Western medicine has only been around for about 225 years or so. And what they have accomplished in that short time is incredible. And there are missing pieces. And what I think Chinese medicine does really well is it looks at what are the root of illnesses and how do we prevent them. Western medicine's strength is in diagnosis with machines and x-rays and MRIs and CT scans, and also in acute critical care, right? If you're in a car accident, you want to get to the ER and you want to get stitched back up or put back together. And then you want to go to your integrative care person to deal with the trauma and the and get everything back into balance. So we don't go to our Western doctor and say, hey, I need help with this, processing this car accident. I'm afraid to get into a car. We go to either integrative care or therapy or things like that. So with digestion, the way that they looked at the body was different than Western medicine. We look at the body very much as the body is more like a garden and not mechanical. Western medicine sees it very mechanically oriented. 1 + 2 always equals 3, and that's the way that it works. It's more fluid in Chinese medicine. And so the way that when Chinese medicine first began, at that time in history, thousands of years ago, it was against their belief system to open up the human body. The human body was considered sacred and was not to be opened up. So not until Western medicine came in the 50s, 60s into China, did they ever open up the body and see where all the organ systems were. So just from that one thought process, they look at the body really differently. And so when we use organ systems names like stomach and large intestine and small intestine, it's the energetic system of it. They did not have the physical Western knowledge of what was going on. So unfortunately in the 60s, when Chinese medicine was being translated into Western medicine, or into English, the Chinese docs were there, the Western docs were there, they would describe something and the Western docs would said, oh, like that sort of sounds like the liver, we'll call it the liver. And so the translation is not one for one. When I talk I usually talk about your Chinese spleen or your Chinese stomach. And what that means is that it's the energetics of it. It's not your physical organ. I hope that makes sense. It's a different language. So in Chinese medicine, their thought process of how the stomach works is that the food comes in, we chew it, and it goes into the stomach, and what they call is the fermentation ton. And at that time, everything that comes into your stomach has to turn to 101-degree soup. And so in thinking about that, they, in China and all Asian countries, you can go around to restaurants and to people's homes, and they do not use ice. And the reason for that is that they do not want to put out the stomach fire. Anything that we put into our system that is cold, cold makes our bodies contract, and it makes our stomach contract. And so it actually decreases our metabolism and our ability to digest well. So in Chinese medicine, we either want to drink room temperature liquids or warm at all times. If you're going to drink something that's cold, try to let it sit out for a while so it comes down a little bit or warms up a little bit in temperature. Obviously, you can't like have a warm beer. That's not very tasty. But try not to have it like a really cold, something really cold. And so think about when people are sick or the elderly, what is the first thing that we think about bringing people? We bring soup, right? And the reason that we bring soup is because it is easy to digest. So here's a resource question for your body. When your body is fighting a virus or bacteria, or it needs to digest, which one is it going to pick? If there's food in your belly, it's going to pick digestion. And that means that it's not going to fight whatever you're fighting, the bacteria or virus or, illness. So when we feel sick, our bodies automatically, our brain tells us like, I don't want real food. I just want soup. I barely want a cracker. Like, that's all I want. And that's our brain telling us like, take it easy on the digestion because we want our body's resources to go to healing, to getting better. We don't eat like steak and potatoes and green beans when we're like having a fever or cold or flu or something like that, right? That sounds crazy. So one thing to remember is that, especially for children, it's really important. You don't want to put out your stomach fire. So in Chinese medicine, there's a saying for everything. And one of their sayings for digestion is to eat so that our stomach is a third full, and then another third to fill with warm water or warm tea. What do they serve in Asian restaurants? They always bring you hot tea. That's why they're bringing it. And then a third of your stomach should be empty. So it's a little hard to measure, this is a saying, but it kind of gives you an idea. Like you want to not overfill your stomach. You want to give your stomach enough room so that when you put the food in and the hot water in, it can make that 101-degree soup. Because the easier it is and more like the soup it is, the more quickly it can be utilized in your system. So the other thing that they talk about in Chinese medicine is you want to eat so that you have a colorful plate, so that you have, like, the ideal is to have all the colors of the rainbow on your plate. So our American diet really doesn't look like that. It typically looks pretty white or brown. Some veggies maybe, and maybe one veggie. But we want to get as many colors as possible. And the other thing is we want to get as many tastes as possible in one or two dishes. So we want the sour, the sweet, the spicy, the bland, and the salty. So think about when you go to, you'll now understand the psychology behind Asian restaurants. When you go to an Asian restaurant, they have sweet and sour. right? They have sweet and sour sauces and things like that. They don't really have a very good dessert selection, right? That's kind of not so good. But what happens is you're not really looking for it because you've received it in the meal. So that doesn't mean like eat a tablespoon of sugar in the meal, but anything that is sweet in nature. So even like rice, white rice is actually sweet in nature. So you want to get as many colors on your plate as possible every time you eat. And if you've missed a color, then have it for a snack later on in the day, which also takes care of all the minerals and nutrients that we need, right? Because we want to be able to vary it up. We don't want to eat the same thing, day after day after day. They say that, if you eat the same thing more than 3 times in a row, that the weakness of that food becomes your weakness then. So what does that mean? Like thinking about if you were to eat tuna, for example, if you were to eat tuna 3 or 4 times in a row, breakfast, lunch, and dinner and breakfast, then the potential for mercury issues in your system is going to be greater because you just continue to put it in. So you really want to, if you eat something, twice maybe, and then vary it up, and if you eat something for lunch and dinner, the same, but then vary it up after that. So another saying that the Chinese have is to eat like a king at breakfast, and a merchant at lunch, and a pauper at dinner. And so again, that flies in the face of our Western culture because we skip breakfast, we may have lunch, and we have a big old dinner because that's when we get together in our communities. So really we want to have breakfast bigger and as big as possible. So the reason that is because the Chinese follow the environment. So they believe that the sun is our biggest fire energy in the universe that we are aware of as humans. And so that is fire energy. And we are talking about stomach fire. So our stomach fire is supported best when the sun is at its peak, which means morning until 1 o'clock. So if you're going to have, something heavy like meat or, things that are heavier and harder to digest, you want to have that in the morning lunchtime part of the day. I remember my Chinese teacher, she said, when she was explaining all of this to us, she said, oh yeah, I eat steak and eggs every morning. And I was like, oh my God, that sounds terrible. And it's taken a while to shift to that. But I will tell you, when you eat really good, clean protein and you have that first thing in the morning, you've just like exercising, you got energy and brain clarity and immunity for the rest of the day. You are good to go. However you start your day in the morning is really important with your food. And then you really want to eat as a pauper at dinner, meaning you just want a small amount, and you want to make sure that it's easy to digest, because again, you don't want to, and I know we talked about it a little bit last time with sleep, you don't want to force your energy resources, your body's resources, to pick between digesting a heavy dinner or having to sleep, because if the food is in there, it's going to pick digestion every time. So on those days, on those nights that you have a really heavy dinner and you're like, oh yeah, I didn't sleep so good last night. And that's because your body was like, oh my God, I've got to throw all resources into digesting. There is no time for sleep and repair. There is no time for brain cleansing, anything like that, or immune building. So you're always thinking about, how is my body and brain resourcing? Where do I want the energy to go? Of course, we want to eat as much organic, fresh, whole foods as possible, not processed. Eating on choosing foods from the outside of the grocery store. You really want to have very few foods that come from the middle, because the middle is typically canned or boxed and processed. So you want fresh vegetables, meat, seafood, and a little bit of dairy in general. So you want fresh whole foods as much as possible. So another thing, another paradigm to understand in Chinese medicine, so is that foods are broken down in Chinese medicine according to nature. And so when something is damp in nature that is affecting our body, it can show up symptom-wise in a lot of different ways. It can show up, think of dampness outside. So like today's a really, like damp kind of day. And so like, what is your overall feeling, right? You want to like curl in, you want to put the covers back on your head. You don't even want to get up. May have a little bit of brain fog. Dampness can show up as phlegm. It can show up as allergies or sinuses. It can show up as stomach aches. It can show up as diarrhea. It can show up as vaginal discharge. It can show up as edema. It can show up as extra weight. So things that are damp in nature, we can't control the environment, right? We got up and we're like, okay, it's kind of misty and kind of damp out there today. And we want to be able to decrease the amount of dampening foods that we have. Now, if we were living in Colorado, our systems could handle, or Arizona, a dry climate, our systems could handle more damp foods. Here in our environment, we cannot handle as much because our bodies and brains are handling the environment, which we have no control over. So what that means is we take control over what it is, what we have control over, which is the food. So we want to take a look at decreasing our dairy, wheat, and sugar are the three biggest dampening causing foods that we have in our American diet. So one of the things that wheat does is when it goes into our system, wheat has gluten in it. And if you think of gluten, if you think of a pizza crust, when you that has gluten in it and you go to stretch it, it's stretchy and tight. And so you think about kind of what that does in the intestines. And what they have found is that when we eat wheat, it actually paralyzes the cilia, which are the tiny little hairs that are in the intestines, and it paralyzes them so that they're not pulling nutrients out of the body. So wheat is small amounts. If you're a blood type O, I would not eat any wheat at all. Blood type O's do not have the enzymes in our bodies to digest wheat. The other aspect of wheat that is a whole nother story is the GMO part and the glyphosate and the toxin part of the American wheat. Wheat in Europe is very different, and we can actually eat more of that type of wheat. So wheat in general is not a great food because of what it does. The thing is that we have to kind of fight with our psyches is the reason that we're attracted to it is when we take in wheat, it actually calms the heart and it actually calms the spirit. That's the nature of it. And the reason that it does that is because it's dampening in nature. So if you're totally stressed and anxious and you're like, oh my God, I need to eat something, what do you reach for? You reach for a carb that typically has some sort of wheat in it. And that's because you are medicating yourself with dampening food. And so you're going, oh my God, give me the wheat, because I want to calm down because this feels awful. And so we're self-medicating with our food. So once you start to understand that, you can look for other resources to help with the anxiety and not go for food that is damaging and not damaging, but just not great, not healthy for your system. Sugar is another one that is a dampening food. And dairy is as well. So think of the consistency of dairy, think of ice cream, of yogurt, of cheese, all of those things, they're thick in nature. And so a lot of people who have environmental allergies, if they have it at a certain time of year and they take out dairy during that time of year, they don't have allergies. They don't have symptoms because they're not constantly putting in that damp food. The body, again, will resource. It can't handle the environmental dampness as well as the food dampness. It's going, oh my God, I'm like way overwhelmed with dampness. And so then we get symptoms. So if we take out the dairy during allergy seasons, that will typically reduce allergy symptoms by a lot for a lot of people. Sometimes it'll get rid of it completely. Dairy is very inflaming to the system. So it's inflaming to the brain, to the body, everything. So in Chinese medicine, what's really interesting, thousands of years ago, what they figured out is what we're coming to realize today with Western medicine, is that there was one school of, there's many different schools of thought in Chinese medicine, and one school of thought was, if the only thing that you do as a practitioner and as a human being, if the only thing that you do is to balance your digestive system, the rest of your body will heal. They figured that out thousands of years ago, and now it's being proved by Western medicine on a daily basis. So your digestion is really, really important to all aspects of your being. How you physically digest is how you mentally digest. So you want to take a look at some other things that you can do in terms of when you're eating, and we were talking about, filling up with a third full of your stomach with food, is to try to, if you can't, if that doesn't give you a good visual, another thing that you can think of is to stop eating like a couple tablespoons or a half a cup or so before you get full. And total protein that adults should have is between 70 to 90 grams a day, depending on your activity level. So if your activity level is higher, you'd want higher protein to help support your system in the exercise. One thing that they say in Chinese medicine actually is to eat your protein first, and then your vegetables, and then any carbohydrates, and your carbohydrates to be, whole wheat if you're eating wheat, organic if possible, of course. And that will allow you to make sure that you get your protein in and your colorful veggies in to get the nutrients in, and that you'll fill up on that and maybe a little bit of carb. The worst thing in the world, I'm Italian, I grew up Italian, and the worst thing in the world is, we Italians, you start with a basket of bread, before we'd have the meal, and we'd totally fill up, and it was like, we don't want anything else. We'd eat a little bit of this and a little bit of that, but that's not what you want to fill up on. That's not good. I had digestive issues for 13 years and was in a lot of pain with it. And when I started learning these principles and started changing my diet, I don't have any digestive issues anymore. My brain's clear. I feel better. I don't get sick. It's all good. So, and when you're eating meat, you want to keep it small amounts, like in the 3 to 5 ounce serving per meal. Like you don't want to eat a huge, pound steak or pound burger or something like that. So to balance your gut, you want to make sure you're taking a look at your diet. You're looking for nutrient density, colorful food. You want to eliminate the simple sugars, because that's going to feed the bad bugs and make the bad bugs proliferate, and the good bugs won't be able to keep them. You want to support your digestion if needed with enzymes and hydrochloric acid. So typically when I work with somebody in working with enzymes or hydrochloric acid, hydrochloric acid is a very specific protocol. I would highly recommend working with an integrative healthcare practitioner to do that. Because of the way that the acid works in the body. And basically what hydrochloric acid is you're adding stomach fire to your stomach. So if you've eaten cold foods your whole life, or had, drank ice sodas, or had a ton of antibiotics or had chemo or radiation, or just, your gut health is not greatest. It's okay, but it's not the greatest. One thing that you can do is you want to be able to follow these principles so that you can increase the stomach fire and increase the good bacteria. There's also something called the prebiotics, which is fiber for the probiotics. So I think of the prebiotics for anybody. I think y'all may remember this one, but remember Pac-Man? There's a little guy and there's like all these little dots. So the prebiotics are the little dots, and the probiotics are eating them to get the good bacteria to be massively wonderful and in balance in your gut. So there's prebiotics and probiotics. Most people need probiotics, and that's, I think we talked about that in the brain health segment, that even from a brain health standpoint, we need the probiotics. And right now, I think everybody should be on probiotics for immune system, for brain health, and for gut. It's one of those things that I think everybody should be on. I don't know any American stomach that has a really good balanced stomach fire. If you look at, some of the things that they do in China is they will have soup and meat first thing in the morning. Like they'll have chicken soup, meat and their veggies and the warm liquid all combined, all beautifully done together. And their digestive system is so much stronger than our digestive system. They don't have nearly the issues that we do gut-wise, unless they go to a Western diet. The other thing that they do is that they'll put every single night, they will put a hot pad or a hot, either a heating pad or like a rice sock, and heat it up in the microwave for 1 or 2 minutes and put it on the stomach at night, because you're adding heat to the stomach and you're adding heat energy to the stomach fire. So A, it can digest, and B, it can just add some of that energy into it. So that's another helpful thing that you can do, is do that at night. And for those of you who try that and it feels fabulous, do it every night. It is a beautiful thing. It helps you relax your system. It helps tell your psyche you're safe. It'll help with sleep. I don't remember if I mentioned that last time. Be careful with antibiotics. I'm a firm believer there's a time and place for everything. I tend to go towards integrative healthcare before I go to antibiotics, to see if I can help to balance things out myself. And if not, then I use the antibiotics. Antibiotics are very cold and bitter in nature, and they wipe out all your good bacteria. So one study I read showed that it took, after one round, anywhere from 7 to 10 days, after one round of being on antibiotics, it wiped out the good bacteria completely for the next couple of weeks, which is why people get on cycles with antibiotics. They feel better, the antibiotics are still in their system, and then the bad bacteria take up, and then they get another infection. So that could be like a UTI, an ear infection, a sinus infection. You get into loops with these things. So what's really, really important is, if you have to be on antibiotics, is you want to take probiotics at the same time, not at the same time of day. You want to take them a couple hours apart while you're taking the antibiotics. And then the study showed you need to take them for 6 months after you take the antibiotics. One course, 6 months. So for example, as a child, I was borderline, I had borderline TB, what they thought was borderline TB. And so I was on antibiotics when I was 3 years old for an entire year. I can still taste that pink penicillin. That messed me up pretty good. We didn't have any knowledge about probiotics at that point, but that set me up for my 13 years of hellacious digestive issues where no doctor could figure out what was going on. So it's really important, if you're going to take antibiotics, to take the probiotics while you're taking the antibiotics, and to take them for another 6 months afterwards to get your immune system back up. Because the quickest thing that you want to do is get your immune system back up. That's what's most at risk when you take antibiotics, is the 2 weeks after. That's the time of most contagion at that point, because your system has no good bacteria to fight. So another thing you want to do is to remove any infections and toxins, working again with Chinese medicine and naturopath. Any integrative healthcare practitioner is really helpful. And, acupuncture and herbs and food therapy and all of that. So it is really helpful. So I did that in 48 minutes. Okay. Is there any questions? I promised you, I know what I was going to say. I promised you about probiotics. So on average, it is my humble opinion from the research that I've done and working for the past 20 years with clients, for an adult average is to have 50 parts per billion B in a dose per day. So if you've taken antibiotics, you want to bump that up to about 100 parts per billion for a good month after that, and then you can go back to the 50. But kind of overall general maintenance is 50 parts per billion per day. So one serving of yogurt gives you 8 parts per million. There is not enough yogurt that you could possibly eat, number one, digest, number two, and it's cold. So it's also putting out the stomach fire. So yogurt's nice, and people are like, oh, but I eat yogurt every day. That is like throwing sand that's throwing 3 kernels of sand on a raging fire. It's nice, but it's not going to make a huge difference. We really need to add probiotics into our system by supplemental. So so any questions that I can answer for you? Oh, there's
Yes, I have heard that we should let our stomach rest for a certain number of hours, this interval fasting idea of, 12, 16 hours, something like that. How does that fit in with, these meals, the breakfast, lunch, and dinner?
Right, good question. So I think just like every other diet fad, this is a fad that they're finding, and I think it's good for people who are pre-diabetic and tend to lean towards that, who are having blood sugar issues. But what I find is that when people who do the fasting on their own and they're hypoglycemic, that actually can aggravate them and make them weaker and have more anxiety and palpitations, and their brain's not working and they're getting really irritable and things like that. So if your blood sugar is stable, I think it can be helpful to do the interval fasting. And what I would say is to do it from night until morning. So if you eat at 6, 7 o'clock at night and not eat anything else, and then go to 7 or 8 or even 9 in the morning, and then have breakfast, I would give it a rest at that point. And it makes sense for me to do it that way at night, because we don't want our bodies to resource to digestion during the nighttime, right? We want it to heal, make our brain stronger, make our immune system stronger, and repair from the day, move all those short-term memories into long-term memories. That's what we want sleep to focus on. So it makes sense to me from that perspective as well.
Okay, thank you.
Yeah, absolutely. Freaky G, were any of these studies blinded studies? What do you mean by that? Because there were placebo groups.
I mean that the researcher doesn't know whether they're giving placebo and the recipient, no, that's a double-blinded study. So no built-in way of prejudging unconsciously what you're doing. Those are the top
Right.
kinds
Right.
of
I don't know if I can't answer that question. What I do know is that with the children, with the kindergartners, well, with all three of those studies, I can't answer that. Good question.
I have another question, and that is in terms of when you go to the shelves in the store. I've been taking probiotics for decades, and I think they're wonderful. I don't think there's as much difference between different types of them. I mean, yes, you can look at the parts per billion, but the plethora of them in the store is overwhelming.
It is totally overwhelming. Agreed. So a couple things that I would take a look at. One is I would make sure you're getting, as long as you're not traveling, which we probably aren't at the moment, I would get refrigerated, probiotics that are refrigerated. I would get as many, what they're finding now is they're finding more and more strands of good bacteria, and then they're able to make them pharmaceutically and then, put them into pill form. And so I would get ones that have as many different ones as possible, different strands as possible. And I would change that up every time you every time you change it. Or every time you finish your bottle, I would go to the store and get a different brand, because you would want different strands. And, you're wanting to feed as many different strands as possible. They just don't have enough information to really give better than do different and change it up. And the other thing I will say is Saccharomyces, I'll put it in the chat here. Saccharomyces is one strand. There's, lactobacillus, there's a bunch of different types. And Saccharomyces is one that if you are having chronic diarrhea, that has been shown to really help with chronic diarrhea. So.
But you talk about, I am going to have to travel later in the month, but my habit has been, even if it doesn't say refrigerate, I refrigerate and I put them in I sort my
Right.
stuff and pre-sort it so it's easy to take, and then I keep it in the fridge until I take it. But when I travel, I can't do that. So
yeah, so at that point, then there are like a lactobacillus that you can usually get from behind the pharmacy. You typically have to ask for it. It's not out in a normal pharmacy. You have to ask the pharmacist, or you can, like Sunshine Pharmacy, I know they carry it, I think. But that you don't have to refrigerate. So you can then still take it. One thing that I have found is with probiotics, and I'm a supplement snob, because I have seen a lot of crappy different things and what they do to people's systems. So for probiotics, if you're going to spend money on probiotics, that's the one to spend it on. I mean, it's usually anywhere from $40 to $50 a month. I mean, you can get lesser quality, but I don't think, any test that they've done, once things have been shipped out, there's not much left of live bacteria in there. And so to pay the good money for probiotics, I hate to say it, that you got to do it. I wouldn't get anything that's not a good quality pharmaceutical grade.
do you up the dosage for anything other than after taking antibiotics? I mean, I don't take very many. I'm allergic to some antibiotics at this point in my life, several. And I take it as little as possible. But I did get a strep infection, then I had to take it.
Right.
And I didn't up the dosage, but things got back to normal pretty quickly.
Good. So, I mean, normally I would recommend if you're doing 50 parts per billion per day as a maintenance dose, I would up it to 100 parts per billion while you're taking the antibiotics, and then for the first month. And then the other 5 months, I would say go back down to your maintenance, but just really make sure. But like I said, at this point, with all the things that are going on in our environment, like you want to have a strong immune system, I would just say 50 parts per billion per day, every day.
Well, I started doing it years ago and I found it really beneficial.
Mm-hmm.
But now I'm planning, I have to take a trip that I don't want to. I have to go to my second home.
Mm-hmm.
And I'm starting to plan it. And I think it's going to be a little more stressful than usual with very different habit patterns. Under those circumstances, would you take an extra?
Sure. Yeah. I mean, you could throw in an extra 50 either every day or every other day, you know, depending on your stress level, but it'll absolutely help with your stress, because stress is going to kill the good bacteria. So you want to keep getting it in while the stress is taking it out. So absolutely. Good question.
Okay. Thanks.
Yeah.
Thank
you. Any other questions?
So Whitney, the one that you were recommending, was that the Saccharomyces?
Yeah.
Okay.
Well, that I was just saying that's a specific one if there's chronic diarrhea or chronic soft or loose stools. But I'm not, that's one of the many that are out there. They have honed in on that research wise to help with that specific complaint or symptom.
Got it. Okay.
Yeah. But I would say, you know, plethora, many. They have BrainMD has a, I'll put it in here, has a I think it's called Pro Brain Biotic. It's like one word, but I think if you search that, that's a really good one. That doesn't have quite as many. If your digestive system is fine, your immune system is strong, I think that has 15 parts per billion, but if there's any brain issues like learning issues or memory issues, that's a really good one to add in. So sometimes I'll take that and I'll find another one that has another, 30, 35 parts per billion, and I'll combine those together.
Okay.
Whitney, it's been a while since I looked at probiotics in the store, but it is mind-boggling. I mean, it seems to be a sea of choices.
It is.
Can you guide us in any way?
So one of the brands that I use that I don't know if I'll check right here while we're talking to see is called Immuprobio. IMMUPROBIO. Let me see. I of course get it. Oh yeah, it's on Amazon. So it's Health Aid is the brand, and it's Immuprobio. I'll put it in here. Health Aid in the chat. Immuprobio, and so they have capsules that are 50 parts per billion, and I like theirs because it's a really good company. It's a good brand, and it's got a lot of different strands of the probiotic in there.
So you said to change it up when you renew or when you rebuy.
Right.
Just take another one with 50, find something else, or?
Yeah, what you'll find is that most of the store brands that you'll look at will not have 50 parts per billion, which is fine. If they have 25, you got to take 2 capsules, right? But what you'll find is there's not that many that actually hit the 50 billion mark. So that narrows it down really quickly. Mm-hmm. I'm trying to think, let me see if I can give you all some other brands. I just always, order from my supplier. I would say, yeah, that brand is okay. I'll have to take a look, and maybe I can have Zach put it in the next newsletter that he puts out. So
Great.
I'll do that as far as other brands.
Thank you.
Yeah,
That would be so helpful.
I'm not sure what's available in the store versus what I can get. And so if I tell you a bunch of things that I can get, that doesn't help you. So
Whitney?
yes.
I have a
Hello.
question. Ann. There might be some other cancer patients that are listening now. I don't know. I don't want to zero in on just me. But, and I want to ask my oncologist about the probiotic also. But I don't, once I asked the internist, my internist, he said, if you do go ahead and do a probiotic, you should alternate the brands, not after you use one up and then like different strands you do, like you finish one and for the month or whatever, and then go to another probiotic. He said alternate them each day.
So like get two brands and kind of alternate like that. Yeah. Yeah, you could do that. I mean, either way, I think is, the thing is they just haven't really honed in on how this all works, which ones we really need more for what. And, the only thing that they've really, narrowed down is the Saccharomyces for loose stools. And people,
oh, go ahead.
Sorry. People who have been diagnosed with, after you have the antibiotics and then you have diarrhea, my brain just went off. But the Saccharomyces is really helpful for that. Yeah. Sorry,
No, I'm sorry. The internist told me that. I haven't taken it to my oncologist yet. And I'd like to try to do it because whenever I get nervous, my stomach, I'm not outwardly nervous. It's my stomach,
right,
that churns up.
Right.
And so I would like to go ahead and take it, but do you have any problem with any, I'm metastatic breast cancer. So do you have any problem with any of the cancers that this would interfere with that you know of over your history?
Right. In my personal history of working with patients who have been diagnosed with cancer, I have not had any issues. Okay. It is all because especially depending on the treatment, it's almost even more necessary because their immune systems, everything's being,
compromised.
Yeah. And so it's really, really, really important for that. I mean, if it was me personally, I'd probably do 100 parts per billion per day.
Yeah.
If I was in that compromised situation.
And I don't do radiation or chemo. I never have. It's an oral pill that I take, and that works with something in my buttocks too, with another one. So I'm not the normal person usually.
But are you taking something that?
Yes.
Are you taking like a estrogen?
Ibrance, a hormonal.
Okay.
Chemo.
Okay.
Yes.
So anything hormonal is going to put it's the same because anything hormonal is going to take out the good bacteria. So people.
Yes, that's true.
Women who are on birth control, same thing. Yep.
Yeah.
Any type of hormonal is going to affect it.
Whitney.
Thank you for your input.
Yeah, absolutely.
I just had it's kind of a random thought, but they're writing about the pandemic and people who've had COVID and been treated and gotten over it having digestive problems. And it occurs to me that as a result of all the treatment, as they haven't sorted out whether it's the disease or the treatment that's leading to these digestive issues that are occurring for people. Anyway.
The way that I understand, and I've been watching really closely with how Chinese medicine is treating it, the way that I understand, because it attacks more in the lungs area, In Chinese medicine, the lungs and large intestine are connected. So what affects one affects the other. But from what I see, I think my gut says, that it's from the treatment that is causing, because, there's also, so the stress of having it also causes a lot of mental anguish. And so by the time they get through it, you then have to deal with the psyche ramifications of that. And so if your psyche is in trauma mode and you're afraid to be around your family, and you're like, now do I have it? Like maybe I have the antibiotics, but nobody else has it. And, there's like more to worry about. That will absolutely affect the gut as well. So I think it's a really good point.
Whitney, this is Mary Ellen. Hello.
Hello.
Hi there. I am facing knee replacement surgery in a couple months. What would be the regimen for probiotic to help prepare me for that and for the anesthesia?
Good question. So my question would be, are they planning that you know of at this moment to use any antibiotics before, during, or after the surgery?
I don't know, but I'm guessing yes.
Okay. So then I would say you'd want to ramp up right now. And I would probably do, if your immune system and digestion is beautiful right now, I would say stay at the 50.
Which it isn't.
Okay. Then I would go for the 100 and I would start ramping that up. And I would just be really careful about what you're eating right now. And making sure that you are eating the foods that you can digest gently.
Okay.
So that you're not taxing your stomach. From an anesthesia standpoint, do you have an acupuncturist?
I haven't been for a while, I guess, but I have.
But you have one. Okay, good.
Yeah.
So acupuncture can move the toxicity of the anesthesia out of your system 75% quicker than your body can do on its own. And it's typically the anesthesia that you feel bad from, or that you have a brain reaction from later. Like, some people will say they have memory issues after having anesthesia. So you want to get that out as quickly as possible. What I would highly recommend is going to whoever's taking you to the surgery, and when you get out, is it same day, or are you staying over?
No, I'll have to stay over.
Okay, same day.
That's why I'm waiting for a while.
I gotcha. So, which is better. You don't want to stay over. So I would, whoever's taking you, I would go see your acupuncturist as soon as you leave the surgery. You're going to be looped out. You're not going to know what's going on. Get acupuncture. There's you can ask your acupuncturist. There's what's called a NADA protocol, NADA, and it's a detox protocol. So we use it in all sorts of things. We use it for alcohol and drug withdrawal, and to help stop cravings from toxicity and or from drugs and alcohol. But it's 5 needles in each ear. And so you want to get a treatment for 45 minutes with that treatment. And then you can go home and go to sleep.
Okay.
So anytime I work with my clients, I have them come. I don't care if it's 9 o'clock at night by the time they finish, whatever. I will meet them in a parking lot. I will put the needles in. They can go home, whatever it is. But it is so important to get that out. And it also starts helping kick in your natural endorphins, which will help with pain management. And it'll also help decrease inflammation. So every single client that I have treated like this for the past 20 years that I have followed this protocol, every single client has gone back to their doctor, and their doctor has said, "What the heck did you do? You're healing beautifully. I don't understand."
Great.
And I am, it is the acupuncture right after, and as soon as you can possibly do it. Yeah.
Great.
If you have to wait the next day, okay, but I'd really like it the day of.
I'm glad I asked. Thank you.
Yeah, absolutely. Sure.
Whitney,
Yeah.
this is Rita. I have a question. Can you speak on GERD or heartburn for this?
Oh, yes. Yay. Thank you for asking me that.
Sure.
What they have found is that the root of the issue, functional medicine, which is a branch of Western medicine that's not fully integrated in Western medicine, functional medicine looks at how can the human body work most, maximize its efficiency. So it's not, Western medicine is, put the fire out, but it's not about maximum optimization of the body. And so what functional medicine does is it looks at maximum optimization of the body. And what they have found is that when they have done tests, is that actually acid regurgitation usually happens due to low stomach acid. So we've all been told that it's due to too much acid, but that is not what is happening. What's happening is the stomach needs so much, Chinese medicine, I'm going to say stomach fire. The Western medicines would say the stomach needs so much acid. And if you don't have enough, then there's not enough pressure in the stomach to keep the epiglottis closed. So if there's not enough acid, the epiglottis is open and the acid travels upward, and that's how you're going to get it up and through your throat and upward. So it looks like you have too much acid. In my experience, I can pretty much guarantee, I have never seen somebody with too much stomach acid. If somebody had too much stomach acid, they would have had to eat differently. They would not have been able to eat the Western diet. The Western diet alone will wipe out your stomach acid because it's cold. We eat late at night. We don't pay attention to when we're eating during the day in terms of our big meals and all of that. And we drink iced drinks, and we're drinking iced tea, and, and we're eating ice cream when we're little, and, and when we're older, and all of those things put out our digestive fire. So the problem is that when somebody starts taking an acid blocker, you need that because you don't want acid in your esophagus and causing ulcerations, right? You need to stop that functioning. But what you really need to get to the root of the issue is you need to build your stomach fire. And for that, you need a functional medicine practitioner to work with.
Okay.
So, and because you want to be able to work with somebody who can work with your doctor, I would never, ever, ever, ever say to get off your acid reduction, medication. I did not put you on it. I'm not seeing you as a client. It is not my training in Western medicine. But what I would do if somebody came to me and said, hey, I want to decrease this and I want to get to the root of the problem, is I would work with either Chinese medicine or functional medicine to be able to get my acid back up and get off of those. The thing is that if you're on acid reducers for a long time, if you're constantly reducing what is already reduced, your stomach acid, you are also reducing your brain power. Like you're reducing your stomach fire and your brain fire all at the same time. And so they've shown memory issues for people who have been on long-term acid reducers.
How about acidophilus?
Acidophilus is one of the strands. So acidophilus, lactobacillus, Saccharomyces, Bactophydium. That's one strand of the many strands that you can get in a good overall probiotic. Another thing I would say in terms of probiotic is I would go to a natural health food store to get your probiotics. I would not, unless you're getting them over the pharmacist counter when you're traveling to get the non-refrigerated kind. I would not go to I wouldn't get them at Ingles. I wouldn't get them. They just don't have the good quality. You're going to be wasting your money. It's
Okay.
just not good quality.
Thank you, Whitney.
Yeah, you're welcome.
I'm sorry, I didn't talk about digest with my, your comments about prebiotics. Do you take a prebiotic? When would you take it if you don't take it all the time? I have a friend who takes prebiotics, but I don't understand I understand what you said about the relationship, the Pac-Man
Right.
concept.
So if you have digestive issues, I would do both a pre and a probiotic.
Okay.
If your system's in balance, I think you just need a probiotic.
Okay.
If you take the probiotic, if you've never taken a probiotic and you take it at 50 parts per billion and you're not seeing a difference, like in brain clarity and in digestion and in your immune system, then I would say you probably also need a prebiotic because there's something that you're having trouble digesting. And so to get the prebiotic feeds the probiotic, it's the gas for the probiotic.
Yeah. Okay.
Yeah.
Okay. That's very clear. Thank you so much.
Okay, good. Thank you. Any other questions? Okay. Well, I will get the probiotic brands to you. Take a look at Zach's next mailing, probably Sunday, Monday. And I'll see what brands I can pull out for you that you have access to. And if not, you can always get your probiotics through your acupuncturist. Will typically carry, or a natural health food store is always a good source. I would not get like a CVS brand, or if it's cheap and you think you're getting a good deal, it's probably not live, and it's just you're wasting money. So, and I don't like to spend money, but for things that make a difference, I'm willing to spend it. So.
May I ask one more question, Whitney?
Sure.
Do you then recommend refrigerated probiotics?
I do.
Okay.
Yeah, I think that is because you want them to be live, and they're live. The refrigeration helps keep them live longer.
Okay, that made sense. Thank
So
you.
you'll typically, you wouldn't want to buy them and then let them sit in a hot car for like 4 or 5 hours. That kind of kills some of them. They need to be refrigerated.
Thanks.
Yeah. All right. Well, it has been a pleasure as always being with you all. I love your questions, and I thank you for that. And I thank you for your attention. And if you have any questions, if you need a functional medicine referral or anything like that, I will type in my email address again. I've got many a resource for anybody who needs anything. So, yep.
You have been, your talks have been so informative, so deep, and I really thank you.
Oh, you're welcome. You're welcome. I love to
Yes, thank you
share.
so much.
Yes, thank you.
You are welcome. I love to share, and I can go on and on. I get a little excited. So that's why I called Zach and I said, okay, you got to shut me off. Like, how much time do I have? I'll go on for days. All right. Well, you all have a good day.
Thanks. Bye.
All right. Bye.
Bye-bye.
Bye.